Many people misunderstand thyroid health, especially when it comes to iodine and seaweed. Some believe they must avoid seaweed, fish, or iodine-rich foods completely. However, this is not only incorrect, but can also harm overall health. The thyroid plays a critical role in the body. It absorbs iodine from the food we eat and uses it to produce hormones that regulate metabolism. In simple terms, it controls how fast your body uses energy, recovers, and maintains balance. Iodine is essential for thyroid function. The idea that consuming iodine causes thyroid cancer is a misconception. There is no solid evidence that higher iodine intake directly increases thyroid cancer risk. In fact, iodine deficiency can lead to more unstable thyroid conditions and potentially worse outcomes. In countries like Korea, where seafood consumption is common, iodine deficiency is rare. As a result, thyroid-related conditions often have better outcomes. On the other hand, in regions where iodine intake is low, thyroid disorders can be more severe and diverse. The key point is balance. Food is not medicine in the sense that one meal will cause or cure disease. Problems arise when people excessively avoid or obsess over certain foods. For example, completely eliminating seaweed from your diet can lead to deficiencies in essential minerals. Seaweed contains not only iodine, but also many nutrients necessary for maintaining body balance. Patients who have undergone thyroid surgery or treatment often become very sensitive about diet. However, the focus should not be restriction but overall health. A diet that supports immunity and recovery is far more important. There are specific situations where temporary dietary adjustment is needed. For example, before radioactive iodine therapy, iodine intake may need to be reduced for a short period. This helps improve treatment effectiveness. But this is temporary, not a lifelong restriction. Some people misunderstand this and continue low iodine diets for months, which can lead to other health issues, including mineral deficiencies and symptoms like muscle cramps or tingling. Another common misconception involves soy foods like tofu. Some believe they negatively affect hormones, but plant-based compounds behave differently in the body and can actually be beneficial. For individuals taking thyroid hormone medication, daily fluctuations in energy and mood are common. Morning energy may feel normal, while evening fatigue or emotional sensitivity can increase. This is part of the body's adjustment process. Maintaining a stable daily routine is essential. Regular meals, good sleep, and stress management help support both physical and emotional balance. Ultimately, the most important principle is this: do not fear food. The body needs a variety of nutrients, and balance is key. Extreme restriction can weaken the body. Health is not determined by a single food choice, but by consistent habits over time. Instead of focusing on what to eliminate, focus on what you are properly including in your diet. The body is simple yet honest. When you consistently provide what it needs, it gradually moves toward recovery. Start with one small change today. Focus on balance. That alone can begin to transform your health.